So now we're going to go over bed mobility, how to scoot yourself around in bed. So we want to avoid excess use of that leg when you're immediately post-op. So we want to make sure we're not using a lot of weight through it or pushing through it a lot. So the way that we're going to get around in bed, so this leg is our surgical leg. You can see that we're a little too far off the end of the bed here. So what we're going to do first is we're going to slide ourselves up towards the head of the bed. So Chris, what I'm going to have you do is I'm going to have you bend your non-surgical leg and put your foot flat. He's next going to put pressure through this non-surgical leg to lift his tushy up and slide himself up towards the head of the bed. And you'll do this as many times as needed to get yourself in a good position. Now, if we're too far towards the left and we want to move towards the right, it's important to remember you can move this leg. We just don't want to excessively move this leg. So it's okay to move your leg. What we're going to do in order to scooch towards the surgical side is this leg will remain bent. Chris is going to put some pressure through this foot and lift his tushy up. Next thing he's going to do is slide his whole body this way and then actively move his leg over. Let's go one more scooch. Good. So now he's all the way towards the right side of the bed. Last thing we're going to do in this position is we're going to discuss how to roll over in bed. So the day after surgery, you may need a little assistance moving this leg around just because of pain medication and anesthesia, but you really should progressively regain use of your leg, and it should be easy for you to be able to roll over in bed. So what we're going to do is we want to make sure that we're not doing too